Right, you guys, you won't believe this case. Someone sent us this medical case study, and it's wild. This construction worker had a seriously unbelievable accident.
Oh, wow.
Okay, so get this. He fell from 13 feet. Like, that's already bad, right?
Yeah.
But then, yeah, he gets hit by a cement mixer. Like, one of those huge ones
Oh my God.
that weigh over 22,000 pounds, amputation, fractures, internal bleeding, you name it. It's honestly kind of a miracle he even made it to the hospital.
Yeah, I mean, it's incredible he survived at all. And, this case is a great example of how a patient can really just push the boundaries of survivability. You see, this worker, when he got to the hospital, he was in something called the triangle of death.
Oh, triangle of death. What is that?
Well, it's this deadly combo of three conditions. On their own, they're dangerous, but together it can be a recipe for disaster. So we're talking hypothermia, acidosis, and then coagulopathy.
Okay, so break that down for me. Hypothermia, that's when the body temperature is super low, right?
That's right.
And acidosis, is that something to do with like the pH balance of the blood being off?
Yeah, exactly. Acidosis means the blood's too acidic, and that throws off a ton of the body's critical processes.
Okay.
And then you've got coagulopathy, which means that the blood can't clot properly.
So basically, it's like all of the body systems are going haywire all at the same time.
Yeah, that's a good way to put it. And when all three hit at once, it is incredibly difficult to treat, and especially on top of, the injuries from the accident itself. In fact, for this patient, the predicted mortality risk was almost 90%.
90%. So basically, he had a 1 in 10 chance of surviving this.
Pretty much, yeah.
Wow. I'm already hooked.
Yeah.
So how did he even make it to the hospital alive?
Well, he was rushed to a local hospital, and his vital signs were, well, not good. His heart rate was through the roof, like 140 to 150 beats per minute.
Yikes.
And his blood pressure was dangerously low at 80/50, and he was breathing really fast, too.
Okay, yeah, those are some seriously scary numbers.
And it actually gets worse. His blood tests showed his hemoglobin level was critically low. I mean, we're talking 41 GL.
I know hemoglobin's important. It's got something to do with red blood cells, right? But why is that number so scary?
Yeah, so hemoglobin is basically the delivery truck for oxygen in your body.
Okay.
It's a protein in red blood cells, and it grabs oxygen from the lungs, and it takes it to all the tissues and organs in the body.
Okay.
So with a hemoglobin level that low, his body was essentially suffocating, like trying to breathe through it like a tiny little straw.
Oh, gosh. So what did the doctors do first? It sounds like they had to act incredibly fast.
Yeah, immediately, right away, they started pumping him with red blood cells and also fresh frozen plasma. It's like trying to give his body a jump start, trying to replace all the blood he lost and to get his blood to clot properly.
Oh, wow.
And then it was straight into emergency surgery.
I can only imagine with the injuries that he had, how intense that surgery must have been.
Yeah, it was really like putting together like a shattered vase. They had to repair a severed left thigh, fix a ruptured vein in his leg, and then there was this severe damage to his right calf. They even had to reconnect this major artery in his leg, which is a really delicate procedure called an anastomosis.
Wow.
And to add even more to that, the bones in his right leg, they were completely shattered, so they had to stabilize them using a special needle called a Kerr needle with external fixation. So it was a very long surgery, tons of specialists working together.
Wow, my head's spinning just listening to you describe that. So what happened next? After this insane surgery, what was next?
Well, he went straight to the ICU. But even then, he was far from stable. His blood pressure was fluctuating like crazy, and he was showing all the signs of being starved of oxygen.
Makes sense.
Yeah, so they had to give him massive blood transfusions. We're talking like 2,000 milliliters of red blood cells, 2,800 milliliters of plasma, and 26 units of something called cryoprecipitate. Basically a super concentrated dose of clotting factors.
Wow. You're probably thinking, how much blood can one person possibly need? But remember, he had those horrific injuries and had already lost so much blood.
Right, and unfortunately, his problems didn't end there. So his blood tests, they revealed another problem. His lactic acid levels were crazy high, like 11.0 millimole.
Okay, so I need a translation on that one. What does a high lactic acid level even mean?
So that's basically a sign that the body's going into overdrive.
Oh, okay.
Trying to compensate for the lack of oxygen. Think of it like when you're sprinting and your muscles burn.
Yeah.
That's because they're producing lactic acid. In his case, it meant that his organs were having a lot of trouble functioning properly.
So not only was he dealing with the initial injuries and blood loss, but now his body was fighting this internal battle against like not getting enough oxygen.
Exactly. And things were about to get even more complicated because, despite all their efforts, his condition was so severe that he needed to be transferred to a different hospital. This one was 4 hours away for specialized care.
4 hours in an ambulance in that condition. That sounds like a recipe for disaster.
It was a huge risk, but they didn't have any other choice. And as you might expect, the transfer didn't exactly go smoothly. During the ambulance ride, he started having these episodes of ventricular tachycardia. So his heart rhythm was going totally haywire, beating dangerously fast.
Oh, no. So on top of everything else, now they're dealing with heart problems. This is sounding more and more like one of those medical thrillers.
It really was. And, the drama was really just getting started because when they finally arrived at the new hospital, something happened that sent everyone into panic mode.
Don't leave me hanging. What happened?
Within seconds of arriving, his heart went into ventricular fibrillation. It's basically a chaotic quivering that can't pump any blood. He went into full cardiac arrest.
Wait, are you serious? He survived the fall, the cement mixer, the surgery, the transfer, and then his heart just stops.
Yeah, it was a critical moment. And, obviously the medical team jumped into action. They started CPR, gave him adrenaline and norepinephrine to try and get his heart back into a normal rhythm. Yeah, it was a critical moment. And, obviously the medical team jumped into action. They started CPR, gave him adrenaline and norepinephrine to try and get his heart back into a normal rhythm. And after 40 minutes, they finally got a pulse back.
40 minutes of CPR, that's incredible. They must have been exhausted, but what kind of shape was he even in after all that?
Oh, he was still really unstable. I mean, his pupils were dilated, he had this abnormal limb flexion, and his Glasgow Coma Scale score, it was a 4T, which basically means a really severe brain injury. And this, unfortunately, is when we see the triangle of death really start to take hold.
So all those conditions we were talking about, the hypothermia, the acidosis, and the coagulopathy, it was all happening.
Yeah, all of it. His blood tests showed almost no hemoglobin, and his blood was extremely acidic. And his heart rate was still high. His temperature had dropped to 34.5 degrees Celsius, and his blood pressure was still super low, even with the norepinephrine. It was not looking good.
So how do you even begin to treat someone who's that close to death?
It was this really delicate balancing act. They continued with this really aggressive resuscitation, more red blood cells, plasma, platelets, cryoprecipitate, fibrinogen, you name it. They managed to bring his hemoglobin up to a more acceptable level, but it was still very touch and go.
So it sounds like they were just throwing everything they had at him at this point, hoping something would work.
They were, yeah. They also started this thing called targeted temperature management. Basically, they cooled his head with an ice cap to try and protect his brain, but at the same time, they're trying to keep his core body temperature at 36 degrees Celsius.
So trying to protect his brain from damage, but also not let him get even colder. Sounds super complicated. So what were his chances of surviving at this point?
Honestly, not great. Based on the severity of his injuries and using those scoring systems they use to assess trauma patients, his risk of dying was almost 90%, like 89.56% to be exact.
Wow. So basically a 9 in 10 chance that he wouldn't make it. That's incredibly bleak, but I mean, he did survive. So what happened next?
The next few days were just nonstop activity. The vascular surgeons did this emergency embolization of his left femoral artery, basically cutting off blood flow to that area to control the bleeding. But they knew that delaying a full debridement, where they surgically remove damaged tissue, was also risky.
So it was like a damned if you do, damned if you don't type of situation.
Exactly. And on top of all that, they had to manage all his other injuries and complications. He was on a ton of antibiotics, constant blood transfusions, and they were monitoring his blood counts and those coagulation factors really closely.
It sounds like they were fighting a war on multiple fronts at this point, just to keep him alive.
Yeah, that's a good way to put it. And then his kidneys started to show signs of distress. His creatinine levels were rising, urine output was low, and he was developing systemic edema, which is like fluid buildup throughout the body.
Oh no, so now they're dealing with kidney failure on top of everything else. What did they do about that?
They started him on continuous renal replacement therapy called CRRT. It's like a type of dialysis that basically does the work of the kidneys, gives them a chance to rest and recover.
It's pretty amazing how medical technology can do that.
It really is. So on day 2 after the accident, this whole team of specialists got together to assess him, and they were worried about the lack of a pulse in his right foot, and there were signs of necrosis, that's like tissue death, in his right lower leg.
So even though they were dealing with this immediate crisis, they're still finding more and more damage?
Right. And that new information meant they had to make some tough decisions. They decided to go ahead with a debridement, removing the dead and damaged tissue from both of his lower limbs.
I can't imagine having to make those decisions. Trying to save his life, but knowing you might have to amputate.
It's one of the really difficult parts of trauma care, but they were committed to doing whatever it took to give him the best possible chance, even if it meant some really tough compromises.
So they did the debridement. What happened after that?
Okay, so day 3, the urology team, they had to do a scrotal incision and exploration to remove some more blood clots. Good news was that his testicles, epididymis, and spermatic cord were all still intact.
Okay, well, that's at least a little bit of good news.
Yeah, definitely. And as we get to day 5 of his hospitalization, we actually start to see some real progress. His blood counts and those coagulation profiles, they started to stabilize, his urine output went up, and they were actually able to stop the CRT.
So his kidneys were starting to recover. That must have been a relief for everyone.
It was, yeah. It was a really good sign that his body was starting to turn a corner. By then, the necrosis in his right leg, it was really clear where it was, which meant they could plan the next surgery.
What did that involve?
They did another debridement on his left leg, and unfortunately, they had to amputate his right leg below the knee.
That's a really tough reminder about how devastating these accidents can be, even with the best medical care.
It is. But even with that loss, there were these signs of incredible resilience. 7 days after the accident, he started regaining consciousness. They were able to reduce his sedation and pain meds, and he started responding to commands. They even started him on some light rehab training.
That's incredible to think that after everything, he was starting to recover mentally and even doing some physical therapy.
Yeah, it really shows how powerful the human body is, how it can heal even after this unimaginable trauma.
So what about day 8? Did he keep getting better?
Day 8 was another big milestone.
Wow.
They extubated him, which means they took out the breathing tube. He was finally breathing on his own.
Wow, that's a huge step.
It was. And although his journey was definitely not over, this was a huge turning point. He defied the odds, he made it through the triangle of death, and he came out of it with a fighting spirit and a chance to rebuild his life. It's really an incredible testament to how advanced trauma care is and the dedication of those medical professionals who never gave up on him.
His story is seriously remarkable. But what can we, the listeners, learn from his experience?
Yeah.
What are the bigger implications of this case? That's what we'll be talking about in the final part of our deep dive, so stay tuned. Welcome back. We've been on this incredible journey, right? Following this guy's story from the edge of death to seeing those signs of recovery, and it's amazing. But now that we've kind of heard everything that happened,
Right.
let's kind of switch gears a bit
Yeah.
and talk about what it all means.
Okay, yeah. This case, it's obviously super gripping, right? But it also gives us some really important insights into how we do trauma care today and, maybe what we can expect in the future.
So for you, what are the big takeaways here? What really stands out about this case?
I think for me, it really just highlights how important it is to have this coordinated, multidisciplinary approach when you're dealing with trauma. Think about all the different specialists who were involved in his treatment, right? We had trauma surgeons, vascular surgeons, intensive care specialists, urologists, rehab experts, all working together.
It's like perfectly choreographed dance.
Right, exactly. And that level of coordination is just absolutely essential when you're dealing with severe trauma. You need expertise from all these different areas. Everyone needs to be on the same page about the patient's condition, and everyone needs to be able to adapt and adjust as things change.
And speaking of adapting, we saw how the doctors had to constantly make decisions about when to intervene. Sometimes, even though it might seem counterintuitive, it was better to actually delay surgery.
Yeah, that's a great point. And this is a classic example of what we call damage control surgery. It's not about, rushing in and trying to fix everything all at once. It's more about prioritizing. Stabilize the patient first, get that bleeding under control, and then you go back and address those specific injuries and stages when the patient's a little stronger and more stable.
We also saw how crucial technology is in these situations. Things like, the blood transfusions, the CRRT, the targeted temperature management, all of these advancements really played a big role in keeping this guy alive.
Oh, absolutely. And it's incredible to think about how far we've come. A few decades ago, the chances of someone surviving with injuries this severe, it would have been very, very slim. But because of all the advances in surgical techniques and critical care and all this technology, we're seeing more and more people, they're defying the odds and making these remarkable recoveries.
It gives you hope for the future.
It does. It really does. And it really highlights how important it is to keep doing research and development in this area. We need to keep pushing those boundaries and see what's possible in trauma care so we can offer hope even to those patients who are critically injured.
And I think what's really interesting about this case is that it really highlights the resilience of the human body.
Yeah.
But also kind of shows us where the limits are.
You're right. It's this incredible thing to see how the body can heal. But you also see the impact of that severe trauma, that lasting impact. Even if they recover, there's a long road ahead, physically, emotionally, mentally.
So after really diving deep into this incredible case, what's that final thought you want to leave our listeners with?
I think, this man's survival, it really makes you think, what are the true limits of human healing? As technology keeps getting better and better, what will we be able to do in the future? This case, as awful as it was, it gives us a glimpse into that future, a future where even these really, really severe injuries might not be the end. And I think that's something we should all be striving for.
Yeah, it's a powerful message. Well, it's been an amazing journey, hasn't it?
It has.
From the lowest lows to seeing these glimmers of hope. That's the power of a deep dive, folks. We'll see you next time.